do you mind if I ask you a few questions?
Sure.
Okay, what inspired you to go into medicine?
Yeah, so it started with my dad, who was a doctor. He inspired me a lot. I also want to help the underdogs out, basically. I want to help out people who are going through their darkest hours.
And what's your favorite thing about medicine?
I think the clinical training I get here at USC is, I feel very lucky to be able to have that opportunity. I've gotten some great clinical training here.
How do you prepare for exams?
Basically, just Anki all day long.
What's your biggest study tip?
Biggest study tip? I think to get into an environment where you can focus and you're happy and you're nourished.
What's the best study music?
Best study music, it's got to be lo-fi, or for me personally, I like K-pop and J-pop.
What's the hardest part about medical school?
Really learning to do so many different things as a doctor. I think that's one of the hardest parts.
If you weren't studying medicine, what would you be doing?
I could see myself being a public health researcher, something I definitely want to do as part of my career in the future. I think I would also enjoy being a teacher or maybe a cyclist.
Coffee or tea?
Tea.
What's one thing you wish people knew about med students?
We're not necessarily all super neurotic as the stereotypes might suggest. Definitely there are a fair share of us that do that, but I think at the same time a lot of us are really just trying our best and we want to do a good job and we want to care about patients.
Exercise, yes or no?
Oh, definitely. Not that I do a good job of it, but exercise is super, super important, and I definitely regret when I don't get my exercise in.
Sneakers or Crocs?
I'm definitely more of a Crocs and sandals kind of guy. It's just more comfortable.
What's the hardest test you've had to take so far?
Probably step 1, actually, not step 2.
When have you been most nervous?
Most nervous? There was the very first time I ever had to do a OSCE simulation. It was a cardio exam, and I just kind of broke down. It was a very nerve-wracking experience, that first OSCE.
What's some advice for newbies?
I think it helps to get your pillars of health down first. Your sleep, your diet, your exercise. That'll save you.
What's the best thing about being a tech school of medicine?
Best thing. I said it before, I'll say it again. I think the clinical training we get here is fantastic and really couldn't ask for anything better.
And what kind of doctor do you want to be?
I think we as healthcare providers and physicians are kind of uniquely postured to help patients, not just in terms of medical problems, but also with our involvement with research and advocacy. I think being an advocate for the patient as a whole is really the kind of doctor I want to be.